Charleston Birthplace is unique as an option because we are the only freestanding birth center in the Lowcountry. So we have women that travel from other parts of the state, other parts of other states even, to come have their babies with us. We're unique in that there's no other option quite like us around.
I think really the biggest aspect of the care that's provided here that is so unique is the fact that it is very family-centered, and we view pregnancy as a normal process. It's not a medical concern. And then of course, one of the biggest things that makes us unique is that we offer water births, and that's probably what the majority of our families come to us for, and not just the midwifery care that they're going to get, but the care that they're going to get is definitely above and beyond what they would necessarily receive in the conventional OB world.
We're the only out-of-hospital birth center in this area, so that in and of itself is a very unique thing about us as far as being in the Lowcountry. We have longer prenatal visits than most standard practices. We allow for 30 minutes per prenatal visit rather than the standard of 15. And we just really get to know our patients. We're a relatively small practice, and so we typically get to see our patients, especially when they start with us at the beginning of the pregnancy, through several months, and we really want to get to know them and their families so that we can really provide this very personal level of care that no matter how their birth unfolds, they feel supported and feel like we cared about them as an individual.
It's midwifery ran. It embraces the woman. She's ultimately the person that makes the choices as an alternative to what always have been.
It's amazing to take in a pregnant person or even a GYN or any patient and just give them time and spend time educating them about this is what's happening, this is what you can look forward to, this is some things you might experience. And when you're in an out-of-hospital practice, you have that flexibility to kind of provide this education and then put the woman in charge.
We are unique. There is nothing else in this part of the state. There's a birth center in Savannah, there's one in Atlanta, and then there's a couple in the upstate in the Greenville area. So for hundreds of miles around, we're it. Besides hospital birth. And the midwife-led freestanding birth center model of care is not the same as an OB/GYN in a hospital birth. Yes, we do some of the same things, but our model is completely different, so we stand out.